Are we ready to start?
Yeah. Where's the apron?
Where's the bib?
X-rays?
Heart, blood pressure? Who set this up? So how do you prevent problems like this? Well, when you go to the beach, you make a checklist so you don't forget your sunscreen and bathing suit. Over here, we have our checklist so we don't forget our materials and procedures. Use this booklet to help you set it for different procedures, including fillings, crown and bridge, root canal, and etc. If you're not familiar with an item, just look at the item that's labeled, and that's how you're gonna know what is what. Play the guessing game with yourself until you remember it by heart. The pre-procedural checklist can be split up into 3 sections: before seeing the patient, before calling a doctor for anesthesia, and right before the procedure. The checklist can be found in the laboratory or in the binder. Use this so you don't forget a step. Before seeing the patient, know what procedures we'll be doing. Here, we'll be doing a filling on 3MO and 8ml. You can see the color is green, so the patient is confirmed. The front office will be checking in the patient and taking care of the finances by marking them as arrived. And that's your signal to know that the patient's ready to go back in the operatory. Double click the chart and put down the room number that you'll be placing the patient in and your initials. When setting up, have your checklist ready and use it as a guide, starting with one corner, moving to the opposite, down, and across. Your setup should look like a mirror image of the picture. Before calling in the doctor for numbing, Carla's going to have the checklist right next to her, and we're going to go through each line item. The compressor and suction is turned on. The patient's reclined with the bib placed on, and X-ray bib. We're not using the laughing gas. Today's procedure and X-rays are on the computer with the X-rays open. The anesthesia syringe is loaded. The topical is placed inside the mouth. We're not using mouthwash. All the suction tips have been poked through the plastic. The complete setup is open. Use the cassette wraps as the tablecloth. All the foot pedals have been placed towards the doctor. The first burr has been placed in and ran to make sure the wire's working. The X-ray sensor is connected. And lastly, patient reclined with safety goggles.